I think we tend to think of epidemics as infectious diseases, but we're now having an epidemic of diabetes worldwide.
Dr. Sue Kirkman is the acting chief medical officer for the American Diabetes Association. She says millions of people live with undiagnosed type 2 diabetes, the most common form of the disease.
In the U.S., at least, about 1 in 4 people with type 2 diabetes are undiagnosed. We don't really know worldwide, but presumably it's probably higher in many countries.
Type 2 diabetes impairs the body's ability to use insulin, the hormone that regulates blood sugar. The disease can damage the heart, eyes, kidneys, and nerves. According to the U.S. Centers for Disease Control and Prevention, the cost of diabetes in the United States is about $174 billion a year, mostly for treatment of complications and disabilities. Dr. Albright heads the CDC's Diabetes Division.
The projections for diabetes today in the U.S., 1 in 10 has diabetes, so 1 in 10 people. When we look out to 2050, that may become as high as 1 in 3 may have diabetes.
Dr. Albright says more than 50 million people have diabetes in India, followed by 40 million in China and about 26 million in the U.S. Nearly 90% of these cases are type 2 diabetes and are closely related to obesity, aging, and racial and ethnic factors.
It's important to point out that those of Asian descent, Southeast Asian in particular, but Asian descent, develop diabetes at a lower body weight. So even though they may not be as heavy, their sensitivity to diabetes occurs at a lower body weight.
Scientists say obesity and lack of exercise contribute to the increased number of cases, as do earlier diagnosis and people living longer. Dr. Myrlene Staten is a senior advisor for the Diabetes Research Division at the National Institutes of Health.
One of the big concerns of diabetes today is that type 2 diabetes did not occur in children 30 years ago, or it was rarely seen. But as children in America have become heavier, we are now starting to recognize type 2 diabetes in children, especially in children of minority populations, largely African American and Hispanic.
There is no known cure for diabetes, but doctors say making lifestyle changes, such as maintaining a healthy weight by eating right and exercising, is the best way to treat and prevent it. This is Sulima Palacio, VOA News.